Okay. Also, so I have the consent form, but there's some more information that I need to fill that I need to ask you about. So can I ask you to sign it tomorrow?
Yeah, that's fine.
Okay. Okay. So who wants to go first?
I can start off. Can you just tell us about yourself, just like what you do, just a little bit background information, that kind of thing?
Okay, so family medicine doctor, he's board certified. I've been working in primary care for at least 30 years. I'm currently with Baylor Scott and White Clinic for the last 4 years. I see children to adults. Um, I used to see people in the hospital, but now we have internists and hospitalists who see all the hospital people, so I don't see people in the hospital anymore. And then I used to see people in a nursing home, but they have their own internist who sees them all, so I don't really do that anymore. So pretty much just primary care in an office setting.
Wow.
Okay. And so one of our group members pre-recorded her questions.
Okay, sure.
So this was her first question.
Okay.
Yeah, and like we can add it like in the video like later.
Yeah.
Okay.
Would like to give to future medical students? What is one takeaway that you would like to give to future medical students or any advice to students in general?
Okay, so that question is, what do you do to give you an edge over other students trying to get into medical school? And unfortunately, everyone who applies are smart, they have good grades, they take the MCAT and they do pretty well. So I think that my best advice to help you get an edge or seem different than everyone else who comes in and says, well, I've been a student, I have this grade, all I do is go to school, and I'm ready to be a doctor because I want to help people. Everyone says that. So what you need to do is you need to do a little bit more in your social interactions, such as belong to clubs, better if you are an officer to show leadership, community service, maybe take an internship job in a medical related field, something that gives you a little bit more well-rounded picture than just say, I'm just academics. And that I think that carries a long way to help make you look different than other students applying to medical school.
Thank you. A question I have is, where did you go to college and medical school?
Okay, so basically I went to college at Texas A&M, okay? And then I went to medical school at UTMB, which is University of Texas Medical Branch of Galveston. UT has 4 medical schools around Texas. So I went to one in Galveston. And then I did an internship in Corpus Christi it's called SPAWN Family Medicine Internship, but that's in Corpus Christi. And so I spent 3 years there to do my specialty. And then after that, I started working here in Austin.
Oh, great.
Hey, so thank you. So like why did you become a doctor? What was your motivation?
Motivation. Gee, that one's a hard one because I sound like everyone else. One is I like to help people. I think it's a good profession. Basically, you can get a job anywhere you want. You can always make a good living to support yourself, that sort of thing. However, I think it also stems from my past experiences with my own family doctor, and that he kind of inspired me to kind of do the same thing and establish relationships with people and let them grow up and help them with that. So that's probably more that versus saying, oh, I want to be a lawyer or I want to be an engineer or something. So that's kind of steered me toward medicine. And of course, I always liked medicine, like biology, and I advocate for it, so that's always good, while as math, I did okay, but I didn't really love math, so I didn't think I wanted to be an engineer.
Mhm.
Okay, and here's another question from Aubrey.
Okay,
These questions are a little out of order.
that's okay.
How would you explain,
Okay,
how would you explain your job to a 5-year-old?
5-year-old. Okay, so basically to a 5-year-old, I would tell them that I'm a doctor. Most kids know a doctor is, but if they didn't, I would say, I went to school and trained, and I'm here to make sure people either get healthy or stay healthy and help them feel better. Um, that's probably what I would tell a 5-year-old, so.
okay.
Yeah.
Okay. Is this the position you imagine yourself in college? Did you have any what's it called? Other career choices, or were you like dead set on being a doctor? Like at least specifically a family doctor?
One is I always wanted to be a doctor from the get-go, from applying to college. So I was pretty much a straight path. So it's not like I wanted to do something else and then decided to do medicine. Always wanted to be pre-med, always wanted to do medicine. However, when you get into medical school, you get exposed to different disciplines, different specialties or whatever. And initially, I was kind of more leaning toward orthopedic surgery because I like the experience. I like the idea of going in and doing surgery and fixing people, and they're fixed, after you're done. While as medicine, you give them medicine and you hope they do well. But at the same time, I think lifestyle choices kind of made my decision because orthopedics is surgery, and they're on call a lot. They have to do surgery in the middle of the night, on the weekends. Every time they have a car accident, off they go. And I wanted to say, well, I want to work, and when I work, and when I come home, I want to stay home. And I think family practice kind of does, primary care does that for you. So it's not like I have to get calls and then we have to go in the hospital and do a surgery. The other aspect for family practice, why that versus pediatrician or obstetrician or internal medicine, is that I like the variety. I like seeing kids, adults. I don't like to see the same thing over and over again, and so I kind of like that better, and then I like seeing whole families, like kids and parents together, so you get to know them both really well. So you get to have a personal relationship with your patients over the years, and you see the kids grow up, you see the parents, watch your kids grow up. I think that's very rewarding. And so that's why I like family practice.
That's so how how do you go about building relationships with your patients?
Well, basically you get to know them. So it's not like they come in, hey, what's wrong? Here's my test, here's your medicine, off you go. You're more like you kind of start with a small talk, a small chat. A lot of times patients are very willing to tell you what's going on with their lives, or what kind of stresses they're going through, or problems with their lives. And after repeated visits, you get to know them, and they get to know you, and they trust you and say, oh, that's my doctor, not just that somebody sees me. So it's different than you say, well, I went to the urgent care and I saw one doctor, and went back and saw a different doctor. And they're just, they just don't know who's who, but you see the same doctor over and over years, you get to know them pretty well, and vice versa.
Yeah.
Yeah, that's pretty cool.
Yeah.
So going back to where you went to college,
Okay.
what was your favorite class in college?
Favorite class? Well, I have several favorite classes, but I really like microbiology. One, interesting. Two, it had an exact science of this is what the bacteria is, this is how you identify, these are different characteristics of bacteria. And so I like that because it was kind of fun to do, and it was kind of more exact versus saying you have this and you can maybe do this or that or that. It's just, oh, you just do this. And
Okay.
so I did like that quite a bit. Not to say I didn't like biology, and I didn't like anatomy. Anatomy was a lot of fun. And, but I would say microbiology was my most fun one.
Okay, that's cool.
What year did you take microbiology?
Microbiology was, I believe, senior year.
Senior year, okay.
Yeah,
Okay.
yeah. Yeah, it's
Uh,
not an undergrad, it's more upper, like junior, senior, and it's more like an elective.
Mhm.
You were talking about like extracurriculars, so I was just wondering, how did you like, first, like what extracurriculars did you take? And also, how did you like balance that out with like school life? Also, any like part-time jobs or anything like that? Just like,
One is,
overall, how'd you balance your time in college, in med
the reason
school?
why I give that advice is because I didn't take it myself.
Oh, you didn't?
I just went to school and I went to a church and that's it. I didn't join any clubs or anything, but I advise people to do that because I think it makes you more rounded and you differentiate yourself more with other people. But unfortunately, I did not do that, which now I regret. But so you can look back 2020, like what should I have done? And so I give the advice, you should have clubs, you should be interactive, should have social, you should do community service, be more active, give you a more rounded picture versus saying, I just go to school.
Yeah. Yeah. Okay. So how did like the learning experiences like you had in college and in medical school prepare you for your career and practice as a doctor?
Well, school kind of helps give you the baseline knowledge of what you need to know, but nothing really prepares you for being a doctor.
Really?
Because once you get into medical school, even though you have the basis of knowledge, like, oh well, this is anatomy, or this is biochemistry, or whatever, this is what happens, but really in medical school and stuff, you learn a lot more information, and then you learn a lot more like pharmacology, which you don't really learn in college or whatever medical school. And so I think that over time that you develop your style and interview and doing things, but I don't know if anything really prepares you to be a doctor
Oh,
very well. I know in medical school they did have us, do in the second and third year, we do rotations, and that's when you interact with patients. But you always have a supervisor, you have someone over you, it's different when you do that. So I don't know if anything ever really prepares you.
Would you say taking internships at hospitals or like shadowing under a doctor would help prepare?
I think it gives you a very clear idea what they do. So I actually would recommend that.
Oh, okay.
I would recommend shadowing a doctor to see what they do. So that way you get a very good idea of what they do. And then, or an internship somewhere, or work in a hospital, volunteer in a hospital, see what they do. Gives you a much better idea, because I didn't have an idea when I went to college and medical school until later, so.
okay. So there's another question from Aubrey.
How does a biology classes in college help you do your day-to-day life? And are there any classes that you recommend on taking?
Basically, basic biology, don't use. Anatomy is good because then you learn a little bit of anatomy, but it's very basic anatomy. And you learn that in college, and when you go to medical school, you do gross anatomy, and so you're learning that very, very well. So it's more kind of fun, class, but it didn't really help prepare you exactly. You just like, well, these are the basic main things. Like these are the hard stuff, but when you go in gross anatomy, you go into fine detail and a lot of memory. But I would say, take classes that interest you. I don't think one class is going to prepare you more than the other per se. You have prerequisites that you have to take. So obviously, you have to take biology, you have to take chemistry, you have to take organic chemistry. I think one physics, those are required. Organic chemistry helps you a little bit. But really, I don't think the classes in college will prepare you for medical school.
Yeah.
Not really, because the classes are different. There are gross anatomy, there's pharmacology, kinetics, and then you do like surgery, and internal medicine. So I don't know if anything really prepares you for it, but I, I would say take classes that really interest you though.
Okay.
Is medical school structured the same way that college is in terms of classes and time?
Um, I think in the first 2 years, it does seem a lot like college. You go to class, you do labs, you take breaks, you study, take tests. So the first 2 years is just like college, but they throw a lot more information than what you're used to. And then also, there's a lot of other smart people in the class too. So even though you say, well, I'm top 10%, so is everyone else.
Yeah.
So you think, oh man, I'm not in the top, I'm only in the 15% or 20%. Feel pretty good. But some people really strive to be in that top 10%. So they really, really work hard. Second and third year is different. You do part of it, you take classes. Okay, you take a class, and then part of the time you do rotation shift, and then the rotation shifts change on the discipline. So one you do internal medicine, surgery, psychiatry, OBGYN, you do all the core main things. And the fourth year, you take elective of what interests you. Like I want to do ENT, I want to do the heart surgery, I want to do more psychiatry, or I want to do more like infectious disease or something. You can take those kind of electives in your senior to kind of get a better idea to say, yeah, that's really what I want, or no, it's not. So the second, third, and fourth year are different because you do classes and you do electives or rotations. So it's different. But the first two are very similar.
So basically, like the last 2 years of medical school are the fun years.
It seems to be more fulfilling because you're interacting with patients, and you kind of feel like, ooh, I'm really a doctor versus just a student. So the last 2 years are more rewarding, but at the same time, shows you how much little you know.
Wow.
Because a lot of times when you go rounds, the rounds are difficult because you have to round with the residents. So you interact with residents who are in training also who have attending. And so you're under the residents, and the residents will have you go in and go check vitals, check their labs, interview the patient first to kind of, you can give them an assessment, and they'll kind of pinch you on, well, what does this mean? What does that mean? What would you do? Like, I don't know. I'm a student. But after a while, you get to know more and more. And really, I think in residency is when you really learn medicine.
So what is the process of applying to residency?
Basically, either the beginning of your fourth year or the end of your third year, you apply. And basically, you say, I'm going to apply to all these different programs. You send in your transcript, and some have essays or whatever. Some will have interviews. So you have to go in person, do interviews, So you apply, give them all your information, your schoolwork and stuff. Usually an essay of why you want to be a doctor, of why you want to do this specialty, why do you want to come here, what things can you offer us that are your strengths and weaknesses, things you would think in an interview. So you apply, and then after that you get a interview. You get interviewed at several school places, programs, and then part of it's interview, but part of it they show you, this is our program, and this is our hospital, and this is where you can live, and this is what the other residents are like, and this is what kind of life you would have. And that's always good too. And then you wait for what they call the match. So basically, everyone's placed in the residency program, you rank them. In February, March, they do the match. And that's where you decide, oh, I matched in 3 or 4 places, they want me. Then you decide which one you want to go to. Now, if you don't match at all, then after the matching is done, they can do a scramble and see some programs don't fill up. And so when there's available slots, you say, I'm gonna apply for that one, that one, and they take,
Okay.
you know. But some residency programs are more difficult to get into because they're more desired, I guess. Not desired because it's more interesting, it's because of lifestyle.
Oh,
You know, so certain specialties are very competitive. One would be radiology, another one is dermatology, the third one is ENT. Those are very competitive because shoot, you work 8 to 5, you make a good living, you don't get called, you don't get called out. It's a real good, life balance of life. So it's very competitive to get into those. So you have to be top 10%, make good grades, apply, and maybe you'll get it, maybe you won't. But if you want to use just medicine, yeah, you want to get into medicine.
okay. And how is residency different from like being an actual doctor? Is it kind of like the practice stage?
So residency, you depends on the specialty. You do an internship year first. So you do 1 year for everybody. Okay. In the first year, you pretty much have people above you. You have residents who are a little bit older, more experienced helping you, and you have attendings. And basically you go by what you call service. So it depends what service you're on. You can say, I'm be on the service for OB/GYN or labor delivery. That's all you see for that rotation. And some are internal medicine. Oh, I see all the people in the hospital and ICU. Oh, I do surgery. I want to see all the surgical patients and all the surgeons I can help out. So the first year, I think that's when you learn a lot. Also, you cover the ER. You see all these new people coming in. It's like we need these tests, and then they need to be admitted where we're going to put them in. Okay. So the first year is a big time of learning a lot. You don't know much, not really. But then after that, the second and third year, you feel more confident. I know what I'm doing. I've done this before, but you have to teach the younger residents. And so sometimes teaching helps you learn too, because in order to teach them, you have to know it enough to teach someone else. And that helps you learn more to get your more expertise. By your third year, that's when you start applying to where I want to go work, what kind of job, so I want to work at a hospital. I want to work at these different clinics. They're looking for someone. That's when you apply in your third year. And your third year is kind of much, I know everything I'm doing, everything. I'm just kind of honing in my skills before I go off. So it's really the first year you learn a lot. Second year, you're kind of teaching. Third year, you're more thinking what I'm going to do next year, pretty much.
Okay. Would you say like the name of your school like affects your job opportunities in any way? Do you think it matters like how prestigious your school is or like things
Depends
like
on
that?
what, depends on what you want to do. So if you want to say, I want to be a doctor, I want to work in a city, I just want to work in a clinic, and that's all I want to do, just get a job, I don't think it matters. However, if you want to go into a more prestigious job, like I want to work for Mayo Clinic, I want to work, in some of these other clinics that are very prestigious and maybe do research, then I think it matters. Okay. But if you say, I just want to work and I want to work in my hometown, I want to work in Austin, in Dallas, any of the big cities, I don't think it really matters how prestigious your school or medical school is. And really, a lot of times they'll look at experience, so if you get a job somewhere, you work there for 3 or 4 years and you apply for a different job, they'll look at your experience. They don't really want to look at your school at all.
Okay. So are there any other specialties that you wish you would have gone into, like in the field of medicine?
Well, I wish I was smart enough to be in dermatology. That would have been a cool life. Plus, I like that kind of stuff, But in dermatology, they not just do like rashes and acne or skin cancer. They do a lot of aesthetics, like I'll do Botox or fillers, things that people, will pay for. The insurance will pay for, they'll pay for. And so it's kind of a, pretty good lifestyle. I kind of wish I did that, because family medicine, it's personally rewarding, but maybe it could pay better, So primary care is probably one of the lower paying specialties. So pediatrics, family medicine, internal medicine tend to be the lower end paid ones, you know. All the specialties, they do surgery, so they get paid more. And then, like I said, the ones that do procedures, or especially like I said, dermatology, they get paid a lot. I don't know. They say money can't be your source of happiness, but I always believe lack of money will make you very unhappy.
Yeah.
So we already talked about this a little earlier, but like, are there any recommendations or like, is there anything that you recommend students to do outside of their environment or like outside of their academics?
Mhm.
Like, you mentioned the extracurriculars.
Extracurriculars are very good to have. I mean, I would just join one or two clubs. Don't try to join 5 clubs and you don't have any time. Just focus on 1 or 2 clubs. And then if the clubs are more related to what you want to do, that's even better. You know, that, oh, we're going to join a pre-med group. That'd be much better than saying I'm going to join a botany group.
Yeah.
You know, but I would just join 1 or 2 groups and be active in those 2 groups. And I think don't overextend yourself because you have to study and, you know, make good grades too, you know.
Yeah, and I heard that like when applying like for medical school, you want your resume to like paint the picture of you, like it wants to have like a personality.
That's right, because if you look like everyone else, they're like, oh, put your name on the pile. If you can, you know, show your personality, say I'm doing this and this, and this is what I want to do, and this is why, and I've had this experience, and this is what excites me, kind of gives them a little bit of a picture that can, you know, they say, oh yeah, this person is really good and got good grades and very well rounded, and they'll pick you. So I do think that's important.
Okay. Okay, I think we already asked you this, like, we already asked about the question about like, advice to give to future pre-meds. So I'll just skip over that.
Okay.
So, you took the MCAT, right?
Yeah.
So how is it like studying for the MCAT and how did you prepare for it?
I wish I prepared more. Basically, there are prep classes, you know, for MCAT. And looking back, I would recommend to take one. But I didn't do a prep course. I just took the MCAT, and basically you just say, well, I took all these different classes, and you know, I took biology, I took, you know, chemistry, and you know, that's what prepares you for the test. But I probably recommend everyone to take a prep course before,
Okay.
you know, because if you score well, it's easier to get in than if you said, I just scored okay. I think I scored just okay. So, but I would certainly say if you're trying to get into vertical procedure school, or you say, I want to really, you know, you don't want to sweat, you say, I'm going to really do well in the MCAT, that would be the better way to go, is to take a prep course.
Okay.
What would you say a normal working day is like for you?
For me, you know, it's I do primary care, so I wake up, get to work. Basically, I have a schedule. In my schedule, I have scheduled patients, and they come in one at a time. And in between patients, you know, I have to try to do administrative work, such as do the charting. There's a lot of documentation charting that you have to do. Also, take care of phone calls. Patients call, you know, the clinic and just have questions or they want refilled, you have to take care of that in between patients. And basically my day is normally in the morning, I see more like checkups and physicals. In the afternoon, I see more rechecks like, oh, I got diabetes, oh, I got high blood pressure or something. And you check them and say, oh, you need to take your meds and do this or do that, you know, and that's pretty much what I do. Sometimes we'll see some sick people like, oh, I got a cough cold. Well, okay, treat them also. Or maybe they say, oh, I fell and hurt my leg, you know. You see some of those. So you see some that's acute care, but a lot of mine is more maintenance, you know, care, you know. And then also we have slots for new patients. So people haven't had a doctor and you know, take over information and establish them. And then there are some slots are for hospital follow-up. So someone who's in the hospital, you know, and they were really sick, and you want to see the regular doctor within a week or two after being in the hospital to kind of one, update us on what happened in the hospital, what recommendations that you have, because when you go to the hospital, you see the hospital doctor. And when they say, okay, you're ready to go home, you don't see a hospital doctor anymore. You know, even though they put you on different meds or this or that, you know, they expect your primary care doctor
Oh,
to kind of pick that up.
yeah.
So that's good to follow the updates. Yeah. Oh, the other thing is, occasionally they have what we call call, where people call late at night, you know, or after hours, they say, hey, I have an emergency, but I don't get too many of those calls. And then, like I said, I don't go to the hospital in the middle of the night in the ER and see my own patients because we have a hospital service or a hospitalist to take care of that. They do that. That's all they do. So one branch is they say, well, I just go work from, let's say 7 to 7, 3 days a week, and then someone else works the other 7 to 7. And so there's always someone in the hospital with a team, but you don't work 24 hours, 7 days a week, you know.
Yeah.
And so they see all the hospital patients and take care of people in the ER and need to be hospitalized. So that's convenient for us. And you'll see that a lot in a lot of different primary care that they have hospital doctors.
Wow.
So how was your normal day impacted when COVID hit?
Basically, COVID kind of everything went to a screeching halt because everyone would say, stay home. And so once that happened, we transitioned instead of, you know, regular visits coming into the office, we transitioned to telemedicine. So people would do either Zoom or telephone calls to see their doctor. It's definitely very different doing it that way. But that's what we did. So we transitioned to telephone calls or telemed. And then for patients who needed to come into the office, we would try to make sure we, you know, provide a COVID, you know, friendly atmosphere, like everything's clean and scrubbed, everyone's placed 6 feet apart, everyone wears masks, you know, and we did see people with that for a while. Now that COVID is a lot less, telemedicine is still there, but not as much. And then we're seeing patients in the office, but they still have to wear a mask. But for a while, we were doing the questionnaires, checking the temperature. We were checking sure that they didn't have COVID. Nowadays, it's more like, well, come on in. If you're not terribly sick, we'll see you.
Okay.
But with COVID, when it did hit, all the elective surgeries were stopped. The hospitals filled up full of COVID patients. It was real busy at the hospital and the ERs. We had a COVID testing drive-through. We test everybody. They need to be tested, you know. And like I said, you know, and business actually went down. You know, everyone just stayed home and said, no. And so for the first 2-3 months, the volume went down quite a bit, but eventually it came back up.
Okay. Yeah. So with all those challenges, what was the most challenging part of practicing medicine?
The difficult part, there's several difficult parts. One would be, difficult part would be maybe trying to help a non-compliant patients who say, you need to do this and this, and they don't want to. Very difficult. Another one would be treating an angry patient. They're just very angry and unhappy, and you try to make them happy, but you know, I think it's not always directed toward you, it's just something else. That's always difficult. Another difficult one would be an over cautious parent. You see their child and the parents like, but this and this, they're just so freaked out because it's a first child and they're just so scared, and it takes a lot more effort to treat the over concerned parent, you know. That's difficult. Dealing with insurance companies can be difficult, especially if you're trying to get things covered and they say, no, we don't want to cover because it's too expensive. You know, that's always a challenge and difficult. And then of course, charting documentation, they expect you to have it done all the time. And sometimes it's hard to get it all done. You know, so those are the more challenging things, I think.
Yeah. Cool.
Yeah, that should be everything. Is there anything you want to mention? Anything else you want to say in particular?
Oh, well, I think we have one more question.
One
to
more.
ask.
Okay.
What do you specialize in out of the biology? What's your favorite part of your job?
Favorite part of the job? I think the favorite part is when you see patients for years and they're very thankful for your care. I think that's probably the best personal award that you can get, And then, of course, another part would be someone sick. You get them well, and they're very grateful for you helping them get well, because you see a direct difference you made in their life, and I like that too. So those are the two favorite things. And then probably like everyone else, it's a job, and it's Friday at 5, I'm getting off. Make me happy to do it. So my best, I assume everyone's pre-med.
Yeah.
Yeah. So my best advice for pre-med students would be, one, you have to make grades, because everyone else has grades and you're competing with them, so you have to make the grades. That requires study and discipline, unfortunately. But you have to make yourself more rounded, so be sure to, join a club or two, and maybe volunteer, or maybe during the summer when you're not going to school, take a little job or internship or something that more medical related would be helpful. Take a prep class for the MCAT, because that helps too. And that even though they put statistics out there like, oh, we have X amount of medical schools, and oh, we have X amount of slots, and these time people apply. It may seem scary, like, oh, what if I don't make it? You'll make it. And then, for medical school, you meet people from all different places, different schools, and that, also, you meet people who were in school and got a job and didn't like it, and went back to school and then became, want to become doctors. So some people have a different, life pattern. Either you say, I went to school and I went to apply to college, and I went to here and I went to here, which is what I did. But there were some people, I met some who were teachers, coach, whatever. That's what they did before. And they said, I want to be a doctor and treat kids. Okay. So you do meet those also, which is good, and that, I guess the other thing I would say, it's good that you're in college, but don't just study and that's all you do.
All right.
Yeah, you can be a more rounded person, would be better than saying, oh, I make good grades, and that's it. Okay.
Okay.
Thank you so much.
Yeah,
Dr.
thank you
Yu.
so much for all of this.
The other thing is, once you get through medical school, you plan to decide what specialty you want to be, So don't say, I got to be a pediatrician, cardiologist, I got to be a neurosurgeon, or I got to be a plastic surgeon, or whatever, or I want to be deliver babies. You might change your mind along the way,
Yeah.
And it's never too late to change your mind. So, but usually by the time in medical school, you have a better idea.
Yeah.
So I would say, don't worry about it now.
All right.
Okay.
Well, thank you so much for your time.
No problem. You're welcome. Okay.
Yeah.
Wish the best for all of you.
Thank you.
You too. Have a great day.
Okay.